I would like to talk to you about tuberous sclerosis complex. Ringing any bells? I didn't think so. Hi, my name is Briley Davis and I'm a senior at Vidalia High School. My younger brother Cash was diagnosed with tuberous sclerosis complex during infancy. Since then, I have dedicated a large portion of my life to advocating for children with special needs. As an advocate for Cash and others, it is imperative that I share with you the causes, symptoms, complications, and treatment options for tuberous sclerosis complex and how I am actively advocating for children like my brother Cash. TSC can be the result of either a random cell division error or it is inherited. TSC occurs in 1 out of every 6,000 births in the US. Now let's talk about the two types, a random cell division error. About 2/3 of people who have tuberous sclerosis have a new mutation in either the TSC1 or the TSC2 gene, the genes associated with tuberous sclerosis, and they do not have a family history of it. The second type is inheritance. About 1/3 of people who have tuberous sclerosis inherit an altered TSC1 or TSC2 gene from the parent who has the disorder. Cash had a random cell division error, leaving him with the rare and as of yet incurable disease. If you have tuberous sclerosis, you have up to a 50% chance of passing the condition to your biological children. The severity of this condition varies, while a parent with TSC may have a child who has a milder or more severe form of the disorder. Now that we understand about what causes TSC, let's talk about the symptoms and complications. Although the signs and symptoms for each person with TSC are different, the tumor growths associated with the disease can cause severe or life-threatening complications. Symptoms and complications may include the following: cognitive disabilities. Autism spectrum disorder and attention deficit hyperactivity disorder, as well as other learning disabilities, are commonly associated with tuberous sclerosis. Skin defects, mostly characterized as white patches of discolorations or reddish facial tumors that are mistaken for freckles or acne, are also associated with this disease. Heart issues, lung issues, kidney defects, and brain defects are also common. Tumors on the brain may cause seizure activity or other impairments. Finally, let's discuss treatment. Though TSC is currently incurable, there are a variety of tools used to manage the daily effects of this disease. Medication. Anti-seizure medications may be prescribed to control seizures. Other medications may help manage heart arrhythmias, behavior problems, or other symptoms. Cash takes everolimus, which is chemo, daily to help shrink certain brain growths and kidney growths that cannot be surgically removed. Keppra, Sabril, Onfi, Vinpat, and Dilantin, which are all seizure medications, and Cash is currently on the CBD oil trial for seizures. He takes all these medicines twice a day, and he has 2 rescue medicines that can be given in the instance where seizures are continuous and will not stop. Surgery. Sometimes surgically removing a growth is helpful if it affects the function of a specific organ, like the kidneys, brain, heart, or lungs. From time to time, surgery helps control seizures that brain growths that do not respond to medication. Cash had a corpus callosotomy, known as a split brain surgery, in August of 2018, where they separated the hemispheres of his brain, hoping to reduce seizure activity. In November of 2019, he had the vagus nerve stimulator surgery, or VNS. VNS is a pacemaker-like generator that is implanted in the chest wall and is programmed by doctors to stimulate the vagus nerve in the neck. We actually were given a magnetic watch that when we wear, if the stimulator doesn't do its part, we swipe it across his chest to stop the seizure. This surgery was unfortunately unsuccessful. Cash had a tumor resection surgery in October of 2021, where they went in and removed 2 tumors in a bone. They added a titanium plate, and he now has a half-moon shaped scar on the right side of his head. Recently, as of January 2025, Cash is currently being evaluated for the deep brain stimulator surgery. This is a surgical procedure that involves implanting electrodes into the brain to treat seizure disorders. This is often called a brain pacemaker. Our final opportunity for treatment is the various types of therapy. Occupational, physical, and speech therapy can help children who have special needs improve their daily life. Cash takes all of these 2 days a week at school and once a week at an outside facility called the Therapy Spot in Statesboro. These services can help children with developmental delays and other disorders to regain autonomy in their daily lives. Now that we have discussed the causes, symptoms, complications, and treatment options for TSC, and my personal experience from doing life with my brother Cash, I hope to leave you with a broader understanding of the difficulties of TSC and the strength of those who know it as a reality. As you continue on your journey in life, I hope that you will reflect upon those affected by this disease. You know, the one you had probably never heard of 10 minutes ago. But as you reflect upon the unfathomable hardship they face, I encourage you to shift your focus to their unwavering strength and relentless perseverance. Do not allow yourself to be stuck pitying their disability. Instead, envy their tenacity. Going forward, my goal is to live each day a little more determined, a little more optimistic, and a little more in pursuit, or relentless in the pursuit of my dreams. A little more like my brother. Thank you for your time.